Hey guys, Dr. Desai here. I wanted to do a quick video on a sepsis protocol that we're going to be implementing hopefully by the end of this month. It's pretty simple, straightforward, but it requires that we're vigilant about getting our history and doing a good exam. So this is kind of a layout of our protocol here. Couple of things. The most important thing we can do for sepsis patients is to try to get as much information out of them as possible to determine, okay, is this a sepsis or not? And the reason we're doing this is because there's a great deal of intervention that takes place once we take these patients to the hospitals. And if we can start alerting the hospitals that, hey, we have a patient here, this patient might possibly be septic, they can really get on the patient aggressively from the get-go, and these patients tend to have much better outcomes if we're treating them aggressively from the beginning rather than they get there, 2 hours go by, the patient gets worse, and now we're trying to catch up. This patient is septic. We should have implemented all these interventions 2 hours ago. So this is just a way for us to kind of help the facilities that we transport to get on the ball a lot quicker, and for us to also begin treatment on these patients so we can give them the best outcomes possible. So you'll notice suspected sepsis here, and I'm basically videotaping my computer monitor here, guys. Okay, so forgive me for the quality, but you want to get key information. These people, you might get called. They might say, oh, it's a fever, or they're altered mental status, or they're having shortness of breath, or they're having coughing, or they're having abdominal pain. Lots of different areas where you can get an infection. So try to get some history on them. And what we're going to do is we've got a 3-box system here to determine if we're going to call this patient a potential sepsis or not. So the first box here, you have your risk factors for sepsis, okay? We'll go through these. It's going to take a little while to remember all these things, but if you're picking up a patient from a nursing home, in an LTAC, any kind of rehabilitation facility, if you know they have a history of cancer, they're on chemotherapy, they're diabetic, they're on dialysis, they've had a splenectomy, they've been in the hospital recently, or if they've had the flu or any kind of viral illness and now they're having productive cough, diarrhea, they're altered, they're having feverish chills, that's a risk factor for sepsis. The next thing you want to do is just ask some questions that might help potentially, that'll point you towards what's causing their sepsis. I'm not asking you guys to know exactly what's going on, but this is kind of just hey, there's a potential here, so that way we can alert the facilities. But go through and ask the patient questions regarding each of these disease processes. Have you had any kind of cough? Have you been feeling short of breath? Are you having any kind of lower belly pain? Are you having any burning when you urinate, painful urination, any kind of back pain? Are you having belly pain? Do you have a headache? Do you have neck stiffness? Do you have any wounds or rashes on your body anywhere? Do any of your joints or bones hurt? Check them to see if they have a PICC line or a dialysis catheter or any kind of intravenous IV access that they've had in for a long time. Ask them if they have any history of endocarditis or any kind of chest pain or palpitations. If they have any kind of implantable device. Some of these folks have these deep brain stimulators. They have these lower back pain stimulators, all kinds of devices now that are being implanted. Find out if they have any of those. If they do, that might suggest where the source of their infection is. So if they have one of those items or history suggesting any of these processes, pneumonia, UTI, belly pain, meningitis, you have some of these nursing home patients or diabetics that have these terrible feet ulcers or wounds on their back. That's another strike against them. And then lastly, we're going to use our vital signs, which is going to be the most helpful for us because we actually have a way of determining. So heart rate greater than 90, respirations greater than 20, end-tidal CO2. I know we don't have the nasal cannula end-tidal CO2 detectors, but you can pretty much hook our little end-tidal CO2 detectors in, put it in the patient's mouth, and just have them breathe out of their mouth several times and get a waveform and see what their end-tidal CO2 is. Okay, I know our thermometers aren't 100% reliable, but hey, if there's an abnormality there that's in the triple digits, that counts. Okay, if they're hypotensive, okay, we've got a sick one. That's a really sick patient there. Okay, if they're altered, their O2 sats are less than 92%. That's if they have two criterion out of this the abnormal vital signs, then this is a patient that we need to activate a sepsis alert on. Okay, and by activate sepsis alert, currently Pulsera is actually going to have a sepsis activation in there. I don't think it's activated in any of our Pulsera apps yet, and I don't think any of the hospitals are using it yet either. But this is something that hopefully will get activated here in the next few upcoming weeks, and we can start doing a Pulsera activation. If not, then please call the facilities and let them know, just like you would call them if you're taking a bad trauma, you're taking a STEMI or stroke. Call the facility and let them know, hey, we're bringing a potentially septic patient here. We're just letting you guys know. There's probably going to be some confusion. They're going to be like, okay, but just do your part. Let the hospitals take care of their part. If you do have a patient that's a potential septic alert, we're going to go ahead and try to get IV access. We want to go ahead and start fluid administration. IV fluids is a big thing in septic patients. They require large amounts of intravenous fluids, so we want to go ahead and get that going. Okay, well, that's probably the most useful thing we can do. If you got a patient that's hypotensive, start fluids on them. After a liter, if the patient is still hypotensive, systolic is less than 90, and you've still got a ways to go before you get to the receiving facility, we're going to start a Levofed drip on them, and you still want to continue IV fluids at the same time. Okay, and make sure you let your facilities know what's going on with the patient when you arrive. These are some of the pearls and precautions that I'll let you read through those yourself. This is a new protocol that's going to be implemented. So I'm going to go ahead and post the protocol. I'm going to have it posted on Ninth Brain. That way you guys can read through it and study it. And then there is also a short test that will be on Ninth Brain that everyone is required to take. So any questions about this, contact me, leave comments below. This is another step towards attacking one of the biggest, deadliest diseases that oftentimes goes undetected or undertreated. And this is something that we need to work on to try to get the best care we can to our patients. Talk to you soon. Bye-bye.